documentation, inboxes, care gaps, all of this can be automated. We as doctors need to make sure we understand the workflow so we can demand where does it need to pause for us to be involved so we protect ourselves and our patient. You're wondering, should I get this tool for my practice? Ask yourself, what work does this fully own so I never have to think about it again? Welcome to the AI Ready Doctor podcast. It is 2026 already. I can't believe it. I hope that you had a fantastic time, peaceful time, and joy during the holidays and the new year. To ring in the new year, let me talk to you for a moment. We are talking about AI. And yes, I am talking to all you, my colleagues out there, physicians, non-physician clinicians, nurses, respiratory therapists, pharmacists. The AI honeymoon is over. If we know anything about what's happening right now is the majority of you are using AI in a variety of ways, perhaps not as frequent, but it's no longer about which tools of AI. We now have access to AI agents. What are agents in AI really? An AI agent is a system that does more than answer a question. It's not a chatbot anymore. It can actually decide what needs to be done. It can act across tools or systems. It can follow sequence of steps towards a goal. It can monitor outcomes, and it can escalate to a human when needed. So those are not just co-pilots. They are systems, and medicine is reorganizing around that reality. So if you're thinking what's happening in AI, while it feels novel to you, what's happening now in 2026 is agentic AI. And I need us to not just be aware of it, but to be ready for it. So let's get started.
A lot of people still frame this as doctors being afraid of AI or being afraid of AI replacing them.
Yeah, that framing is lazy. We know now there's the famous survey that is quoted everywhere by Dr. Graham Walker from On Call, Off Call, and it was thousands of physicians, and we know that doctors are not afraid of AI. They're afraid of AI being deployed without them. They're afraid of AI deployed without understanding the clinical systems and workflows and without accountability. Because at the moment, I'll tell you the real conflict of 2026 for us is nothing changed for the liability. We still are the ones signing the note. So while the shiny objects are coming into the workflow, at the end of the day, the liability did not change for us.
And so what changed? Start with the biggest operational shift.
Well, I started by saying agentic AI. It's no longer software as system. It's not anymore just a tool. It is that agentic AI is entering the workflow. And if we struggle to understand AI, to work with it before, it's only getting more sophisticated. So we need to be aware of this operational shift. We need to be aware of what agents do and where might they fail, because again, the liability is ours. So softwares don't wait for clicks. They own the work. That is agents, documentation, inboxes, care gaps, follow-ups, prior authorizations. All of this can be automated. And so we as doctors need to make sure we understand the workflow so we can demand where does it need to pause for us to be involved so we protect ourselves and our patients. So if, as a doctor, you're wondering, should I get this tool or that tool for my practice? Ask yourself, what work does this fully own so I never have to think about it again? And where do I need to enter in order to make sure that that protects the patients and ourselves?
So in terms of AI literacy, education is ongoing this 2026. And you've said the search is gone. That's a big claim.
I own it. I said before, and I'm going to say it again. In 10 years, we're going to look back at ourselves and say, you mean we were going to a website with a box and enter vague questions that then gives us hundreds of thousands of results, and we have to click on each one to read them and then synthesize for ourselves. And by the way, the order of those results is dictated by a tech company with ads and with money in mind? No. Nowadays, if you use an AI such as Perplexity, for example, it would synthesize everything and give you the answer with the references. So search is now replaced by synthesis. And we have to make sure that we ask, what are the sources of that synthesis? It's going to sound like a very good, very confident answer, but we need to make sure that we still verify where it's coming from. Our job is no longer just finding information. It is interrogating the conclusions and the sources. And the risk isn't whether we agree or disagree with AI. The risk is if we're not able to explain why AI did it. And from our perspective, the ambient scribes are now used all over the place. So we have to make sure that we see the outputs, and even if it looks like a good plan, we have to make sure it fits with our thinking. And my practical advice is, it's no longer about search and AI gives you the answer for your patient. It's attribution. We need to make sure when we document that we document, here's what AI has powered my thinking and whether I agreed with it or not. It may seem like trivial, but when there is a court or a peer review case going on, this distinction and attribution becomes important.
And what about hospitals? Hospitals stop being the center?
Hospitals are when you go when a crisis happens. I believe that with AI, we're going to usher in finally an era of prevention instead of healthy living. Prevention means that we will be looking at trends of wearables or vital signs and look at perhaps a problem before it happens. Can we envision a world where hospitals are rendered less and less relevant, and what is more and more relevant is care at home based on wearables and individualized recommendations? This is not far in the future. This can be here now. And that means we have to demand that as patients and as physicians.
And what happens to clinical trials?
Clinical trials. Clinical trials are a framework that is ripe for intelligence and for artificial intelligence specifically, because AI can simulate trials, therefore stress testing the hypothesis before we start the project or the funding. AI can actually scan electronic records and find the right patients. AI can also help with giving the counter argument and the thinking process for a protocol design, so you can stress test the protocol itself and see if it fits the lived experience of that patient. And if you do research, you must learn how AI evaluates the plausibility, because that's where the digital twins happen. You can test out a theory in an experimental patient that is individualized to your patient before you can take it out to the real patient. That means safety. That means, indeed, protection for our patients.
Okay, 2025 and 2026 do look a little bit different. And public discourse feels broken.
Public discourse feeling broken. That is because we are seeing that companies that own these AI tools are deploying them without any safeguards, without pause and seeing where can this break? Who might it harm? The race to AI became much more important than the race for wellness to humanity. And we have to stop and start to look at where is the area in which we must protect ourselves and our patients. If the tech moguls are saying that, then why aren't we listening? Why aren't we demanding more? So we see that a lot of laws are being enacted. Europe is far ahead in trying to protect patients, their privacy, and how is this medical software or AI tool is being deployed. Unfortunately, in the US, we're starting to see less and less oversight, less and less regulation. And for that, I think we don't want to be caught flat-footed in having to go on overdrive once something happens to backtrack and implement safeguards. California is enacting a lot of these. We're starting to see, for example, AI that are companion AIs. And we talked about the danger of the companion AIs where people share with them their utmost secrets, and a term that is being coined, which is AI psychosis. It agrees with the person, but what if it's a person who is, in the medical term, delusional? It would agree in that delusion and amplify it. So we're starting to see a lot more age restrictions. We're starting to see a lot more disclaimers and requirements for these safeguards so the public can actually get to trust these tools because there is intention behind them. But for right now, it's broken because while the public uses some of them, there's nobody to teach them how to use them safely.
And what about privacy?
Where do I start? Where do I start? We, as physicians, are trained to not give something that is protected health information to these tools. That's true. But are patients trained in that? Do they know that these things that they share with an AI, including uploading a medical record, do they know that that medical record has become property of that particular company? And that company is only driven by KPIs, by ROIs, investment, money, stakeholders. They're not beholden to keeping the public safe. And so that privacy is essential in trying to teach the public that they own the data, not somebody else. How can they protect themselves? Can they de-identify those records before they upload them? Can they type in the gist of those records rather than copy and paste because that's the easier thing to do? Those are things that we need to teach the public on how to use AI to keep the privacy. We're starting to see that those AIs, for example, are deployed in cameras in the hospitals in order to minimize or predict falls. But we see very quickly that this could border on surveillance. So, for example, in tele-ICU, we have an etiquette that I have to call ahead of time and let the patient know that I'm going to come in on camera so they don't feel violated in their privacy. Another example is when we are talking about the privacy of data from the hospitals. We're starting to see that Medicare is piloting in 10 states AI so that they can do prior authorization for Medicare procedures or surgeries. It's a hop and a skip before we start to see that systems and clicks are the ones making decisions on your well-being. We also see very quickly how this can go into medical insurances or even life insurances, trying to predict outcomes for someone and denying care because the chance of it succeeding is more than the chance, or less than a chance, pardon me, of it not succeeding. But patients and lives are not algorithms. They are people, and they deserve that ethics and humans are watching these decisions. I'll give you an example that we did in one of our previous episodes, which is if you have an ambulance, a fire truck, a presidential car in one of the crossroads, which one has the right of passage first? If you give it to an algorithm, it gives you something, but if you give it to a human, they ask more nuanced questions, and decisions live in nuance in the messy world of healthcare.
And is this education part of AI literacy? Learning about privacy, data?
To be. That is one of the things I lectured on this year, which is the ethics of AI. Now, it sounds nebulous until you put it in words that people understand. Who makes decisions about your healthcare? Who owns the data? Where does this data live? Is it protected? If you have a tool that is made public, has it been approved by an entity that has your well-being in mind, or has it been labeled as software so it escapes the regulatory? And if there are children or adolescents involved, is there an oversight to make sure we don't repeat the same mistakes as social media that has driven the epidemic of loneliness, of suicidality, and so on? Let's make sure that the public understands what it means. And yes, it should be in awareness, fluency, and literacy as the highest level of education of this AI.
So who does the responsibility lie in today?
It's normally it should be, well, the government or third-party entities, but truly we now know that televisions, our mobile phones, everywhere we go, we are being recorded. And we've been fine with it. Fine as in we are aware, we don't like it, but it's overwhelming. How can we have any power to change it? So the responsibility comes on us. If I'm going to use a bank account, my responsibility is to learn how to budget my money. At the end of the day, if I don't, then I'm the one who pays the price when my account goes negative or when I don't pay a bill. Similarly, if we don't have AI education and literacy, then we're the ones who are going to be paying the price. So I say that a big part of the responsibility is individual, and another big part is for our leaders to establish safeguards. Is it too much to hope that the companies themselves will see a bit of accountability and start to put some safeguards there? They won't do it unless they have to.
You nailed it. What about the big platforms? Do they lose ground?
Platforms. Well, credibility beats visibility now. One of the things that will happen, it's not an if, it's a when there's a breach that will happen to a platform that we use. When that breach happens and suddenly we understand that these AI tools are vulnerable, and by that token, we are vulnerable from what we shared with them, then suddenly we're going to start moving into local platforms. What do I mean by that? We could use all of the tools such as PowerPoint or spreadsheets or when they're connected online. But what we prefer sometimes, if we have something sensitive like our own budget or things that are important to us not to be revealed, if we are companies, we use a Word document on our computer. Unless we attach it to email and send it, it remains local to the computer. We are going to start seeing local AI tools have value compared to all these AI tools that are connected to the internet. And I think that that's going to make a huge shift once that happens. Let's not wait until it happens. Let's educate ourselves on how to keep our data private by using local AI tools.
And this one surprises people.
Indeed. When I share with them local AI tool, most anybody who has not been in the AI world has not heard of it. Everybody knows that these apps, you can use them, but did you know that you can download them on a platform in your phone or computer, and that keeps all the data private until you choose to share it. Most people say no to that. That also is part of AI literacy.
So in terms of education, Dr. B, what can you share with us?
I love this part. As you know, I'm a son of a teacher. Teaching comes to me naturally, and I'm seeing that there's a shift in education. Remembering and memory-based knowledge doesn't have as much weight as it did before because that knowledge is everywhere. Therefore, the modern learner is starting to question what's the value of sitting in a class? What's the value of getting printouts and slides and handouts? So what I did recently is if you're an educator and you have not created your own AI clone, we need to talk. I have created very easily a custom GPT, and I fed it all of the slides that I'm going to give to my students, which I sent to them anyways. And in class, what we did is we used now that tool. It has two things. Number one, it teaches responsibly those students how to use AI, how to prompt, how to compare results. And at the same time, it makes them interact and integrate and use the knowledge rather than just learning that knowledge and then regurgitating it in an exam. Furthermore, you can actually, which I did, give the grading to the student and involve them into asking that AI, based on their use, where are the gaps that they wish to concentrate more. And so the age and era of precision education is here. Personalize that education. I've been advocating for all of the platforms that I go to and all of the institutions that host these annual conferences. Can you imagine if you created a tool by which every one of your members has their own custom GPT where they can interact with all of the content you have on your website to shape their own learning path? It's revolutionary and simple, and it is already here.
It is super revolutionary. I think we're jumping from an era of being graded by, are you able to answer this exam or are you able to complete this task, to are you actually learning? Because how much of it before was staying in our minds? How much were we able to retain in our brains as we continue to grow and learn in our profession?
It's important to say that in order to function, whether in society or in a specific job, you must have a level of knowledge that is recall-based. I'm not advocating for it to go away completely. What is important is to have enough to be an expert at what you do, but you also need to use that knowledge, and that's the part that AI came and revolutionized. It also adapts to the learning style. Some of my students like the slides. Some of my students like to read an article. Some of my students want to hear it as a podcast. We have these at our disposal now. Can we not do what we did before, which is one size fits all, and bring up everybody, no matter what their learning style is, by providing them a personalized plan? We can.
And now let's jump into what you don't agree with.
Ooh, yes. First of all, I think that we've said it before. Let's retire the tired narrative that AI will replace doctors. It will not. I have seen another article today about we are giving away our ability to think. We are giving away our ability to read, and we no longer are thinking for our patients. That is absolutely wrong. We still retain a lot of judgment on that, a lot of nuanced. I mean, yes, I could sit and copy a text using Feather and ink blot the old-fashioned way, or I can just go and use a copy machine to copy the. It depends on specifically the situation in which we're in. That is the development of technology. That is the development of the future. We use calculators all the time, but we still know how, if we wanted, to calculate. And those that use that calculation every day in their job are expected to have that recall-based knowledge. So it depends on how we look at it. Number two, AI gives us time back. I disagree with that. Unfortunately, everything expands to fill in vacuum. So if we created a space and vacuum by, say, ambient scribes doing the dictation for us, and now we have a note, we now shift from typing and being a clerk to proofreading and being a reviewer. So it kind of replaces the time that we had before, or as physicians and as clinicians and as nurses and as driven people, we tend to fill in that space with other things. We don't just sit and watch a movie or get bored or meditate. We fill it in with other things. So AI gives us time back is the second fallacy that I think we are starting to find out. And third and last is better models equals safer care. We focus so much on accuracy but we don't really realize that before you start to see, is the model better in accuracy? It's how does it perform in the real world, which is not an experimental environment. So accuracy isn't safety. Workflow design is the safety. Where am I deploying it? Have I trained my users, physicians, and so on it, and so on and so forth? That's the important portion. So those are the 3 points that I disagree with, that if you asked me a few months ago, I would have had a different answer.
And you've mentioned lawsuits.
Yes, I did. We talked about it in the beginning of 2025 when we had our first few podcasts, that people are afraid to use AI because they're afraid of being sued for something that they did not decide, and AI decided. But now we're starting to see that lawsuits are rising because you did not use the AI that your employer has made available for you. So the best way to go in the middle is, number one, be educated. Using AI is what's going to show you where is it not helpful to you. And secondly, acknowledging AI has been used and then modified or not taken into consideration in context of the patient which has X. For example, AI may use it as tremor, but I don't think it's a tremor. I think it's an asterixis. Both of them are hands shaking. AI won't know the difference. The physician would. Therefore, you can say AI has an AI input included in the clinical reasoning, with the final plan being XYZ. And that is the final attribution showing that AI was used, but in the end, it was the physician's decision.
So basically, you can't blame it on AI. You need
If
to be
you're the
the
one
doctor in the
signing the
loop.
note, you're the one who's going to be liable for it.
And I think we started, like you mentioned, 25 speaking of this, and it's a great way to be closing with this knowledge because it is still important.
Becoming even more relevant.
And okay, we're reaching the end of this episode, but I don't want to leave you before we do a little pulse check. So 1 sentence. You're ready? What arrives in medicine in 2026?
What has arrived is agentic AI. Workflows, things being done so you don't have to worry about them. For example, post biopsy, the follow-up and the scheduling, all of these things can be automated. So Agentic AI is here. Doctors are not afraid to use AI. They're afraid to use an AI that has been done while they're being sidelined. And that is AI in medicine in 2026.
Biggest misconception clinicians still hear.
That AI will replace us. Reclaim your voice. This is an insecurity. You don't need to justify. I don't need to justify. I don't need to prove to anybody what my value is. I can stand there with my patient because they're expecting it. But the other biggest misconception is AI is not good. It is extraordinary at reasoning. It just needs to be your thinking partner, not be outsourced thinking to. That way, when you go back to your patients, you have your clinical reasoning augmented by AI, but your humanity augmented also by how AI helped you.
What happens to clinical software?
Clinical software in 2026 is becoming more sophisticated. We need safeguards, we need privacy, we need ethics, and above all, that's what I'm here, education.
Search or synthesis?
Synthesis above search, but search is not completely dead. We still need that. It's just not going to be the old-fashioned way.
What's the real medical legal risk with AI?
The real medical legal risk is not engaging with it and not being able to explain your reasoning.
Ambient AI, good or bad?
If you notice it constantly, it's bad.
Where does prevention move?
Out of the hospital and into our homes, with wearables and with digital data.
One mistake researchers will keep making.
Pitch in an idea that AI told you will fail.
Public platforms or gated communities?
Credibility over visibility any day.
Cloud or local models?
If you cannot explain where the data goes, it's a risk. Local models are an option that's going to become more popular. Educate yourself on it.
Medical's education biggest lag?
We're training for a world that will no longer be in a few years. We must use the thinking and reasoning of AI to augment education.
Who wins, big platforms or small tools?
The ones that fit into the real world workflows. Those are the ones that are going to win.
What becomes more valuable as AI spreads?
Humanity.
Will AI replace doctors?
It replaces pretending that being a computer was the job.
Does AI give time back?
Only if leadership and ourselves protect it. Otherwise, nature hates vacuums, so that time will be filled again.
Accuracy equals safety.
Absolutely not. Workflow design equals safety.
Defensive medicine in one line?
Silence and ignoring the presence of AI is a risk now.
If a clinician listening does one thing this year, what should it be?
Figure out which part of your job gets more valuable with one tool of AI and train yourself for that. It's not hard.
Final word, 2026 in medicine.
Agentic AI is here. Medicine is shifting. Doctors aren't afraid. They just refuse to be sidelined, and they refuse not to protect their patients.
And now, Dr. B, if someone stops walking right now to listen, what do you want them to think about?
Have you used AI lately? If you haven't, let's talk. If you have not, let's educate ourselves. If you are a physician, your patients are dependent on you. And if you're thinking that they're not using it, we need to talk.
Well, we've reached the end of our first episode of 2026. Please share it with any colleague who's still afraid, who doesn't know what to expect, or those who are also excited to continue to learn on this journey of AI.
Thank you very much. I hope that you have a fantastic and successful year. If you have not used AI, it is not too late. Start now. Ready? is a decision. It is not a state. Don't wait to be ready. And curiosity is infectious, so catch it here at the AI Ready Doctor podcast. See you next time.